There's so many words that I could say about COVID. Most of them are not good words.
So the beginning of the pandemic, it almost feels like a blur.
It was just, how do we triage keeping everybody okay right now?
It's been an overwhelming year for sure.
Nia Marshall runs Ivy Kitchen and Cocktails. Fighting to keep her business alive during the pandemic, she focused on feeding others.
Feeding the front lines, feeding the homeless, donating to food bank. Initially, we thought that, after a week or two, this is going to be over and everyone is just going to go back to normal and it's going to be like it's never happened. But here we are.
I thought, okay, how do I take care of myself? And what kind of long-term plans do I need to make for myself that are going to take care of me and take care of what my new goals are going to need to be going forward.
Tasha Lord is an entertainer who saw her gigs dry up during COVID. She's pivoted her focus to helping nonprofits.
But all of a sudden, it went from, a lake of need to an ocean of need all around us.
Mona Shand is the Livingston County Field Representative for Congresswoman Alyssa Slotkin.
There was just so much need. People who needed help with their unemployment claims, food banks that needed help getting access to produce, the need within my own household. We have 3 kids who still needed to eat dinner and, log on to their school sessions, and we needed to find toilet paper. And, I needed to take care of my elderly parents.
It just felt like we were in a giant continuum of, okay, like where are we now? The constant just pressure and stress of being present and ever present in everything that we're doing. I'm a single mom and head of my household, full-time surgeon. And it was like, okay, if things don't get back to normal or what we thought was normal, what is the plan?
Dr. Kelly McFarland is a surgeon with Henry Ford Hospital raising twin daughters.
So it made me really aware of if you didn't have extra family help, resources to hire in more help, what would I be able to do? And that was a really scary thought.
38% of women have left the workforce. They're gone. They're out of the workforce.
We knew there were cracks in our social safety net before the pandemic, as far as childcare, family leave. The pandemic shined a light and, exposed those cracks and broadened them into enormous gulfs.
Everything we thought was safe, protected, organized, or in control of was no longer in control of. And I think that loss of control aspect affected men and women, but when we're the main organizers, caring for everything, controlling the household, caring for ourselves, our families, it really takes a toll.
For me, the most therapeutic thing has been, and it's something I've always turned to, which is fitness. I've also done a lot of journaling through this time because I do feel like what we're living through is historic. And as much as people talk about wanting to return to normal, I don't ever want to forget what we've been through.
There was no mindfulness. You weren't present. You were physically there, but your mind was 10 different places
right
at the same time. One of my me time things is to get that back.
I figured it out early on that I have to keep moving. Helping hands are always needed. And so one of the things that we did in my sustainability company and in my restaurant is we partner with a lot of nonprofits. We started donating, preparing and delivering meals to the front line.
I remember seeing the governor on the social media going this is a war right now and our enemy is COVID, and she really moved me, and I was like, all right, who can I help? So Lighthouse was the first person that said, come on aboard. And I was like, I'm coming. What can I do?
I think the thing that I recognize more profoundly than ever, even though we've been separate from each other in many ways throughout this crisis, is that we are more connected to each other. We needed each other to get through this crisis, and we need each other to rebuild.
Do you know how women are?
Yes.
We take care of stuff. So invest in women because we invest in healthy communities.
And that means providing the infrastructure for childcare, providing the infrastructure to make sure that these women-owned and minority-owned businesses do not fold because we don't have access to the level of capital that others have. making sure that quality care for our elderly exists.
And it's going to take everyone. It's going to take big employers, big business. It's going to take private industry and us as community citizens to really join in and show what we need and what works, and to make sure that women aren't left behind like they were during this pandemic.